So what I'm going to show today is I'm just going to show some release that one could do in the office, at home. If you got some tension in your neck, shoulder tension, just some basic movement that you can do to begin to free that up through via stretching. All right. So right now for me, I have just a little tightness that's happening on this side. So I'm gonna really focus on opening that up. So what I want to do is just start by doing movements across, kind of feeling. So I'm going into the movement and stretching, and then coming back, and then the same thing on the other side. And what I'm doing is almost like as I'm doing it, I'm beginning to pull the muscles, and then let them come back. And it's kind of engaging and stimulating. So you can even go here and come back and pull. Just like that. So it's almost like, you just pulling on the muscle is pulling out and releasing. So there and back. And same thing on the other side. And rotate. And then you can go forward. Yeah. And back. And you can go back. And contract that way. And then back. And then back.
My name is Emory M Jr. and this is Exercise and Movement Technique. Today, I am so fortunate to have two incredible practitioners, Khadija Tudor, licensed massage therapist, Ade Coleman, licensed massage therapist, and licensed Oriental medicine practitioner. So, in the realm of therapies, massage therapy seems to get the least praise or professional standing when you think about the other therapeutic physical therapy or occupational therapy. When you hear massage therapy, you don't think it's a necessity. You're like, oh, massage therapy, that's something that makes me feel good. I go to a massage therapist because I want to feel good. But of course, it's a lot deeper than that. I mean, how long is a massage therapy course to become a massage therapist in New York State? How long do you have to train?
Presently, I think it's about 2 years.
2 years.
Maybe a little less than 2 years.
And in that course, what do they cover?
Neurology.
Neurology.
All the pathologies. Whatever can go wrong with the body, you study it to figure out how it is that massage can help with it. Anything to do with bone, musculoskeletal situations. And then you have, the adjoining concepts of Chinese medicine as far as meridians and so forth. So it's very
So it's pretty in-depth.
Western and Eastern.
Okay.
Mm-hmm.
That is an exhaustive study, and I'm sure, also you have to take exams afterwards. And I know, because I've gone through massage school myself, not in New York State, but I know the depth, and I also know the amount of practice and study that it requires to become adept. So why do you think that massage therapy doesn't get any props?
Can I answer that?
Sure.
I think there's a concept that massage is the thing that you do for your birthday. It's that special occasion spa type of experience, some nice smelling oil, a candle here, and someone rubs oil in your body, and not really understanding that the day-to-day function of your life and the stress that you put onto your body and your mind, massage has a way of helping you to clear that away, and not in an esoteric way. Is you're sitting at the computer and you're hunched over,
Yes.
staring at the computer.
Yes.
You're dealing with neck, back, lower back,
Yes.
carpal tunnel syndrome. Massage directly affects that.
As I adjust my posture. So I'm leaning over to try and I will now shift.
But it's real, and what it is, that once people get it in their mind that this is a maintenance, it's not a special once a year type of thing. It's a maintenance to help you get through in a very successful pattern the day-to-day activities that you have to deal with: job, work, child, just all your responsibilities.
Well, there's two things that I hear that I want to pull out. One of it is stress. what I like to call muscles. People don't realize that muscles are sort of like the awareness center for the body. You know, if somebody yells at you, you will have a reaction in your musculoskeletal system. There was some studies done a few years ago where they had participants watch movies, and they had various acts going on in the movies, and they found that the body, the brain, the nervous system, pretty much the same physiological symptoms as if they were actually going through it was occurring. And I don't think that people realize that you're filling yourself up, but you don't do anything to empty yourself. And one of the things I see massage therapists being able to do is to really cope with not stress in the ephemeral sense, but the actual tension that builds up in the body. There's an actual density change that should happen with the muscles. And I don't think that this is addressed therapeutically in very many other modalities other than, say, maybe deep stretching, meditation. And if you don't have access to those things, and depending if you're in a crisis situation, particularly when you're in crisis, you may need some more conservative care.
Well, interesting that you said deep stretching, but I truly believe that stretching is a form of massage.
Yes.
That's how
we are on the same page.
So it's that same principle in terms of, create and release, that affecting the muscles in such a way, stretching, moving, the contraction, the expansion and contraction.
Right. I want you to talk a little bit about that, because we were discussing that earlier about the contraction, expansion concept of the human body.
Well, I mean, it's something that I've been just really kind of just meditating on in terms of just how the body works.
Okay.
That how everything is in that expanding contraction motion, whether you look at the heart,
okay,
you look at the lungs, and the intestine, the stomach, everything is in that movement. And so how does that expand from the core then to the external, to the muscles?
Right.
You know what I'm saying? And if we can begin to understand that rhythmic flow and make those connections in terms of being able to create movement and healing and affecting our own circulation then,
yes,
by using breath, and then understand how you can influence the heart, because those are the two organs, that deep internal organs then, that we have some access to. In Chinese medicine, they say the lung is the first line of defense.
Interesting.
Right, in terms of the Wei Qi, and the Wei Qi permeates through the skin.
I see.
Right, so
and what do you mean in terms of defense?
Well, in terms of, okay, so when something, what they refer to as an EPF, external pernicious influence, or something coming at you.
Pernicious.
Yeah, the lungs.
Hostile.
Yeah, exactly.
Right.
The lungs is what attacks that. So that's, when you're talking about colds and flus and things,
Sure.
Goosebumps, you feel cold, and
exactly,
all of a sudden your pores raise up. You're afraid, and it's like it's the first initial reaction that's going to happen on that skin level that is going to be seen.
And the lungs is connected to the skin.
Of course, because you have the
breathing.
Exactly.
Yes, the skin breathes.
Yes.
A lot of people don't. The skin actually is semi. It's porous.
Yes.
It's a semi.
So once you begin to understand and begin to create that relationship and begin to expand in that, and I think one of my teachers used to use the word cultivation. These are not intellectual process. You can understand it intellectually,
sure,
but it's another thing when you have to practice.
Well, deep stretching and ways that people take care of their bodies, but the overarching theme is that you must practice. Even if you have the resources to go see a massage therapist every single day, right, even if you have the resources to see a personal trainer every single day, there is something you will not access if you do not practice yourself.
Mm-hmm. Well,
you have to get to know the inner world.
Well, there's a commitment to that. There's a commitment. You spoke about stress, and you pulled that word out. And the stressors, the concept of fight or flight
Right.
or rest to digest. That's what we deal with that.
Fight or flight or rest and digest.
And digest.
Interesting.
Rest and digest is something that we're all doing every day. When you think of a gazelle on the plains of Africa, and he's eating grass and doing his thing, realizes there's a lion coming. The rest and digest portion of eating and just, being there stops. And your whole concept becomes about either survival. I'm going to run, I'm going to fight the situation.
Right.
So your breathing pattern increases, you're in a very tense position, you're waiting to react and somehow, you're very singular in your vision, you're not trying to see, you're not digesting anything. Because all the blood
moves.
Right, all the resources goes to the peripheral.
To the part
That's
that
what
it
you're
needs
going
to
to
be able to
use.
survive.
Right, sure.
So, and when that stressor is over, it stops, it goes back to eat grass. Either that or it's dead because it got eaten by the lion, right? It's the truth, right? But for us, we stay, human beings, especially within this society, we stay in the fight or flight. We're
Right.
driving and we're upset. We wake up and we're like, what's the next thing we have to do? So when a person comes in for a massage or a person comes in to work out or stretch or move, and they just sit still for a minute and it's usually this happens.
Right.
Because you are suddenly able to take a breath.
Mm-hmm.
And that one breath opens up the digestive process. Because people who are under stress are generally constipated, having stomach issues, having skin breakouts because their circulation is not working well, cramping in their legs. It's all tied in. We're not sleeping well because it's all part of, you're in this position of trying to figure out how am I going to survive.